There's tons of studies on animal model, lab, and even humans showing that PRP does improve quantity and quality of eggs in a lot of women.
You also have another treatment that's really interesting, ovarian rejuvenation. So I tried to read a little bit about it, and is it similar to what maybe like PRP, like platelet-rich plasma injections, or?
Yes, it's absolutely, this is it. You know, the PRP or platelet-rich plasma, it's called ovarian rejuvenation. It's really the patient's blood. So we take blood from the patient, 4 tubes, she waits in the lobby, we prepare the PRP from her own blood. We do not add anything to it because every place does it differently. So you have to be careful. Some people add chemicals and calcium and all that. We don't. Then we go vaginally like an egg retrieval and we inject the PRP inside the ovaries. This is done at least 2 weeks before you start IVF stimulation. And the PRP is good for 3 months. If you do it May 1st, it's good for month of May, June till end of July. It improves quality or quantity of eggs or both, but it might not do anything either. I always tell patients, 50% of patients do extremely well on the PRP. 50% is like you gave them nothing. Why? We do not know. It's like everything else. Some things work for others, something doesn't work. Now, we've seen magic with the PRP. There is tons of data, tons of medical research. It's not something that's, oh my God, I heard about it. No. There's tons of studies on animal model, lab, and even humans showing that PRP does improve quantity and quality of eggs in a lot of women. Even in menopausal women, believe it or not, they have up to 1,000 eggs left inside their ovaries. So if you inject PRP, they can wake up some of those dormant eggs because potentially they can be normal. It's very useful for women with premature ovarian insufficiency, POI or POF. We used to call them premature ovarian failure. I don't like the POF term because it's really not a failure, it's more of an insufficiency, but it works very nicely for those patients because usually they're younger than 40 and they have good quality eggs. So all they need is 1 or 2 eggs to make a baby. So in summary, it works very, very well. We've seen magic. I also post on my Instagram a lot of patients who talked about their successes and their journey and their babies.
Wow. So this is more a treatment that you usually recommend for your patients that have primary ovarian insufficiency or perhaps like diminished ovarian reserve, like essentially, or?
Yeah, it can be used for multiple. It could be used for menopause or no period at all to wake up some of the dormant eggs. It could be done for women who have low number of eggs to increase the number of eggs. It could be done for women who have poor egg quality and they're making better egg quality. And believe it or not, a lot of women who have genetically abnormal embryos, sorry. I guess Friday afternoon, I'm not talking well English, but genetically abnormal embryos, they have 4 times chance of having genetically normal embryos following the PRP. Happy to go through the mechanism, but it works mostly on improving the egg DNA division in the ovary. So it's a big range of patients that uses it. That's why when patients ask me, oh, what's the percentage? What's the pregnancy rate? It's very hard to compare apples to oranges. I can't lump everyone who's doing PRP in the same pot and say, oh, your chances are 1% or 2% or 20%. You have to, when you give percentage, you need a big sample size of all the same category. And when you come, then I put you in this category and compare you to others.
Got it. I see. So far you've seen like in the clinic really good success with this treatment.
Amazing.
But like, as far as like publishing, you guys haven't published yet on any of the data, or?
I'm sorry, can you repeat that?
Have you guys published anything about the PRP yet?
We published a lot of studies. If you go to PubMed, PubMed, there is tons of studies. We published many, at least 4 so far. We just had a paper accepted that showed that we have 4 times increase in genetically normal embryos following PRP in women with poor egg quality and low ovarian reserve. So wow. Yes, there's tons of studies there.
That's
happy
amazing.
To share them with you if you like.
Awesome. Yeah. And then, so do you think that this would be the case where if someone at another clinic was perhaps they had gone through a cycle, it didn't go well, and they were considering donor egg, this might be something they would try before moving to donor egg?
The answer is yes. Look, I always tell patients, I'm not telling patients because I want their money to do PRP. It doesn't matter to me. Actually, if they do donor egg, is more money for us. I'm a very straightforward guy, the more you know me. But we have, sometimes you hit the road where, either donor egg or you want to do everything else before you go to donor egg, or maybe donor egg is not an option. Doesn't hurt to try the PRP, because let me tell you, I mean, it did a lot of magic for a lot of patients. And look, I always tell patients, even if it increases your chances by 5%, meaning out of 100 women, 5 will have a baby. It's a baby. It's not a car. So it's a huge thing. So a lot of people cannot use donor egg for religious reasons or ethical reasons, right? So they have no choice but to work on their egg quality. And I really think PRP adds a lot of value in giving those people a chance or an extra chance by having a baby with their own eggs.
Yeah, definitely. And so I'm curious, so you said that it would be, someone would do PRP about 2 weeks before they would start their IVF cycle, or like when during their cycles would they do it?
Yes, at least 2 weeks. The PRP, and I really think a lot of experts thinks differently, because some people say, oh, it takes 6 months. I respectfully disagree. I've seen its benefit up to 3 months, and it takes at least 2 weeks to start working. After 3 months, the effect is gone. And I think a lot of patients agree with me, because they see that period comes regularly for 3 months if they don't have a period, and now boom, there is no more period. It goes back to baseline. That's why some patients, they do one every 3 months, because if they want to, if it works for them and they want to bank more eggs or embryos, then they do it again.
Got it. Okay. Wow. That's fascinating. Yeah. So do we know like what what is happening that is improving the egg quality, like when you do this PRP injection?
So that's this is an hour conversation, but in brief, I always tell patients, your eggs right now are all normal. Before, when you start the cycle, your eggs are 46 chromosome, because human are 46 chromosome, and the man is 46 chromosome. The sperm has to split in the testicle to 223 chromosome sperm, 23 and 23, and same thing the egg. And 23 chromosome plus 23 chromosome, they need to make a 46 chromosome embryo. Now, the follicle, when it's less than 10 millimeters, the DNA is still 46 chromosome. As it grows, when it hits around 12 to 14 millimeter, this is when the DNA splits, right? And then after that, you can't change it. Once it's split, it's split. How you stimulate the follicles to grow from when they're small up to 12 to 14 millimeter does affect how the DNA is split. That's why we change protocols. That's why we give this versus different. If you give them a lot of gonadotropins, it's like you're cooking on high temperature, it's more likely to split faster and unequally. So instead of having 23 and 23, it's going to split 24, 22. It's like cutting an apple unequally. 24 chromosome plus sperm, that's 23, now 47. We call it trisomy, or it's an abnormal embryo. So PRP boosts the egg, the mitochondria, because it has a human growth hormone and a lot of growth factors that are good, that improves the engine that cuts the DNA equally. It's like you're sharpening the knife to cut the DNA equally into 223 chromosomes. That's in summary.
Got it. Okay. That makes sense. That's really interesting. So essentially the PRP is helping with the machinery that's going to separate the chromosomes.
Exactly.
Got it. So that you don't accidentally miss some of them out. Like they divide evenly, essentially.
Exactly. But that's why there's a lot of women, their eggs keep splitting unequally into 24, 22. And then when you give them PRP, now with a gentle stimulation, now their DNA is splitting equally and they end up having genetically normal embryo. This is why I told you that the study that we just published showed that it increased 4 times the chances of having genetically normal embryo following PRP in the same patients.
Wow.
We compare patients before and after PRP. Okay, and after PRP, the same patients in their cycle 2, they had 4 times increase of genetically normal embryo.
That's great. That's amazing that and they had to do it not too far in advance of going through another IVF cycle. So they didn't even have to wait too long. Like if people, because a lot of people worry about having to do treatments and then waiting for their IVF cycle to start because they're getting older. So that's good that,
Yes, you don't have to wait too long. With my experience, you really don't have to.
Wow. And the injection you're doing, where are you injecting? Into the ovary?
inside the ovary itself. Correct.
Okay, got
It's
it.
like retrieval. Instead of sucking eggs, I'm now injecting PRP. Now, every place, in every doctor or every place, because now there's a lot of people who does PRP. It's really different. I've had patients who come to me to do PRP and they've done PRP somewhere else. And I ask them how they had the PRP and they say, oh, we had one injection. I really do it differently. I inject multiple of the surface area of the ovary, transvaginal ultrasound. And let me tell you, it's not easy, especially when the women have small ovaries and low number of eggs. You really need to know where you're putting the PRP. Otherwise, it's not going to work.
Got it. Okay. So there's a very specific area that needs to be placed.
Exactly.
So when it comes to the ovarian rejuvenation, they asked a two-part question. So they want to know, do you have any patients that have been treated in their 20s for low ovarian reserve that did ovarian rejuvenation?
Yes. So 1% of women in the United States have something called POI, or premature ovarian insufficiency. Those, by definition, they're women younger than 40 and their period stopped. So yes, I do have a lot of those women who did PRP and have children.
Awesome. And then she also wanted to know, how have they responded to the treatment?
So they responded by developing follicles. A lot of those women don't develop follicles. So when we do PRP, because even though they don't ovulate, they still have 1,000 eggs left inside their ovaries. They started to ovulate, then we collected the egg, fertilize, and make embryos and have babies.
Got it. Okay, awesome. And then what is the best way for people to find out more about you and your clinic and the sort of treatments that you offer?
Sure. So our website is Rejuvenating Fertility Center. My name is Dr. Merhi. And if you go to our website under our services, you'll see a lot of novel things that we do, under our services. If you would like to contact us, you can go to on the website, contact us, and then fill your information, and someone will call you right away. You're also welcome to send me DM me on Instagram, Dr._Merhi, MERHI, or on our Rejuvenating Fertility Center Instagram account.